know, May is Older American Month. During my last career, there were many untold times I had contact with some elderly person being abused. To me, one being abused is too many. A national study found financial mistreatment to be the most common reported form of abuse, followed by neglect, emotional mistreatment, physical mistreatment, and then last, sexual mistreatment. Who are the perpetrators? They are an adult children or spouse, likely to be male or female, to have a history of substance abuse, may have had or have mental or physical health problems, have a history of trouble with the police, they are socially isolated and may be unemployed or have financial problems. The National Osmond Reporting System. What are some of the warning signs of elderly abuse? Broken bones, unexplained withdrawals from normal activity, strained or tense relationship, sudden changes in financial situations, unattended medical needs. We are a society to need to be better educated on what to look for in abuse cases. How can elderly abuse be prevented? First of all, we must take care of ourselves. Stay active in the community and connected with family and friends. Know who you are giving your personal information to. Seek advice from someone you trust before signing any kind of document. Plan your future with the power of an attorney or a living will so you can better address your health care issues to avoid confusion. Who are the abusers of older adults? The abusers, both men and women, in almost 60% of elderly abuse and neglect incidents, the perpetrators are family members. 2/3 of the perpetrators are adult children or spouses. What makes an older adult more vulnerable to abuse? Social isolation, mental impairment, such as dementia and Alzheimer's disease, are 2 factors. Recent studies show that nearly half of those with dementia experience abuse or neglect. Interpersonal violence also occurs at a disproportionate higher rate among adults with disabilities. What are the warning signs in elderly abuse? It's physical abuse, neglect, mistreatment, such as bruising, pressure marks, broken bones, abrasions, or burns. Then there's emotional abuse, unexplained withdrawals from normal activities, a sudden change in alertness, unusual depression, strained or tense relationships, frequent arguments between the caregiver and older adults. Financial abuse, sudden changes in the financial situation. Neglect with the bed sores, unattended medical needs, poor hygiene, unusual weight loss. Verbal and emotional abuse, the belittling, treatment, and other use of power to control by individuals. What are the effects of older abuse? Elders have been abused have had a 300% higher risk in death when compared to those who have been mistreated, while likely unreported elderly financial abuse and fraud costs Americans $36.5 billion a year. Yet financial exploitation is self-reported at higher rates than emotional and physical or sexual abuse or neglect. That comes from the elderly abuse statistics. There are criminal penalties for the abusers. Most states have penalties for those who victimize older abuse. Increasingly across the country, local law enforcement officers and prosecutors are trained in elderly abuse and ways to use criminal and civil laws to bring abusers to justice. How can elderly abuse be prevented? We must educate our seniors, professional caregivers, and the public on abuse is critical to prevention. If taking care of your health, seeking professional help for drug and alcohol and depression concerns, and urging family members to get help for these problems. Attending support groups for spouses and learning how domestic violence services. Staying active in your community and connected with friends and family will decrease the isolation which has been connected to elderly abuse.